I'm really looking forward to the Emotion Revolution meeting in Bergen in 2025. It's the topic, emotion, of course, is the central thing that we deal with in our work as psychotherapists. When my son was little, one of his friends asked him, "What does your father do?" And his reply was, "He's a doctor for feelings." And I think that's what we are. We're doctors for feelings. And at the meeting, there are going to be many doctors for feelings, some of them leading experts. And I'm particularly looking forward to hearing the range of different views. And I'm delighted that the focus is going to be so practical, that the different experts are going to be commenting on the same clinical material, each from their own point of view. I think that's going to be really fascinating. What I find most demanding in my own therapeutic practice is the fact that psychotherapy, at least the way that I practice it, it's collaborative work. One has to have the cooperation of the patient. There's a mutual, reciprocal, collaborative turn-taking in terms of working together, trying to understand and to change a person's life. Sometimes the patient can't take part in this sort of interchange for a variety of reasons, one of the most common of which is a lack of optimism or positive belief that anything can be changed. Obviously, I'm speaking, for example, about depressed patients. Paradoxically, some patients are so pessimistic, so hopeless, so under-energized that they don't believe that anything can change. And sometimes it's even worse than that. It's a sort of negativism, a sort of destructive disbelief that anything can be done, and they sort of actively work against one's efforts to try and help. It's not only depression, though. There also are patients who have great difficulty collaborating, getting on with other people, working together for a common purpose. They get argumentative. They undermine your efforts, even though your efforts are directed at helping them. So this is for me the biggest challenge, is working with patients who find it hard to use the sort of therapy that I practice, insofar as it requires their active, positive, collaborative involvement in the work. What I hope to contribute at the meeting, the ER 2025, is to outline my own way of working, which I've developed over, as you can see, I'm not young, it's something I've developed over decades now. And my main take is an integration of psychoanalysis on the one hand with neuroscience on the other. I've developed an approach which has come to be known as neuropsychoanalysis. And it draws on developments in the last decades in all the neurosciences, including, of course, the cognitive neurosciences. But in particular, it draws upon what we've learned in affective neuroscience about the basic emotional forces that are at work in the human brain, which, of course, are not exclusive to the human being, but rather are fundamental motivational needs, emotional needs that are necessary for survival, actually. Even though emotions, some people think, are fluffy things, they are, in fact, how we come to know our most fundamental needs. And so drawing upon what's been learnt about these basic drives, these basic driving forces that we know, that we come to know, experience as our feelings, integrating what's been learnt about these basic things into how we go about understanding our patients and how we go about trying to help our patients, who, after all, suffer mainly from feelings. We're dealing with emotional troubles in our field. And so this focus on emotion is no accident. It's absolutely how it has to be.